The recent proposals from Arkansas and Indiana to ban certain food items like soda and candy from the Supplemental Nutrition Assistance Program, SNAP, are as misguided as they are troubling. While framed as a measure to improve public health, the reality is that these changes may do more harm than good, both in terms of individual autonomy and the broader fight against poverty and food insecurity. At a time when millions of Americans struggle to make ends meet, the idea of limiting their food choices, especially when these choices are often a small source of comfort in otherwise difficult lives, appears both punitive and counterproductive. The governors of Arkansas and Indiana, along with health officials like Robert F. Kennedy Jr. and Dr. Mehmet Oz, have argued that restricting the availability of sugary drinks and candy through SNAP will improve the health outcomes of low-income individuals. While it's undeniable that soda and candy are linked to poor health outcomes, especially obesity and diabetes, this move fundamentally misunderstands the complex factors that contribute to the health disparities in these communities. It paints low-income individuals as incapable of making sound decisions about their diet, while ignoring the real drivers of poor nutrition: poverty, lack of access to healthy food, and systemic inequality in healthcare. The plan's emphasis on banning diet sodas and fruit juices with less than 50% natural juice is particularly concerning. By expanding these restrictions, Arkansas goes beyond targeting obvious junk food, placing a blanket ban on beverages that many people with limited options rely on. The idea that such a restriction will have any significant health benefits is dubious at best. It doesn't address the core issue: the lack of affordable, accessible, healthy food options. If people living in food deserts or rural areas can't access fresh fruits and vegetables or affordable, nutritious alternatives, then taking away soda won't magically solve the problem. Moreover, these restrictions undermine basic principles of choice and dignity for SNAP recipients. The average SNAP benefit is roughly $187 per month, just over $6 per day for food. For millions of people living paycheck to paycheck, this amount barely covers the basics, let alone fresh, healthy foods. By cutting out specific items like soda and candy, which many families may rely on for small moments of enjoyment or convenience, these bans reduce their already limited choices, essentially treating people on SNAP as though they are incapable of making their own food decisions. This paternalistic approach to welfare reform is not only disrespectful, it's also ineffective. Furthermore, there is no substantial evidence to suggest that restricting sugary drinks or snacks in SNAP would significantly improve health outcomes. Studies have shown that low-income individuals, regardless of whether they are on food assistance, do not consume more sugary drinks or snacks than other low-income groups. In fact, SNAP recipients often face more barriers to healthy eating than non-recipients, including limited access to grocery stores with fresh produce and the financial insecurity that prevents them from purchasing healthier, but often more expensive, food. Rather than targeting specific foods, the focus should be on increasing access to healthy options, improving nutrition education, and addressing the root causes of poverty that lead to poor dietary habits. The involvement of high-profile figures like Dr. Oz and Robert F. Kennedy Jr. only complicates the issue. Their involvement in framing this as a health crisis distracts from the real conversations about how to alleviate poverty and promote true health equity. Banning soda and candy might make for an easy talking point, but it does nothing to address the deeper, more systemic issues that contribute to poor health in these communities. Opponents of the proposal, including anti-hunger advocates, are right to voice concerns. They argue that limiting food choices for the poorest Americans will do nothing to improve their health, but will instead stigmatize and marginalize them further. By reducing the autonomy of people who are already experiencing poverty, these bans risk undermining the very concept of support. Instead of helping people escape poverty, these policies risk reinforcing the idea that low-income individuals are undeserving or incapable of making choices for themselves, despite the overwhelming evidence that poverty itself is the key driver of poor health. In the broader context of SNAP and food security, these policies represent a step backward, not forward. Instead of offering meaningful support to lift people out of poverty through measures like raising wages, improving healthcare access, or investing in food security, states like Arkansas and Indiana are instead making it harder for their most vulnerable citizens to feed themselves. The focus should be on improving access to healthy food and addressing the systemic issues that contribute to food insecurity, not punishing people for their food choices. If these proposals are passed, they will likely be a significant blow to the dignity of millions of Americans who rely on food assistance. They are also likely to be ineffective in improving public health outcomes in the long run. The solution to poor health isn't restricting food choices for the poorest among us. It's addressing the root causes of food insecurity and making nutritious food more accessible and affordable for all.